Good afternoon and welcome to the Department of Behavioral Health weekly update. And we'll just get started. All right. Just keep reminding all of us the nature of racism as a public health crisis. We continue to see acts of violence that we really need to contend with as a nation. And so, again, our department remains committed to doing the work that we need to do to address racism within our department and ensure that the people we serve and the people who work within our department feel that they have a safe place. All right, May is Mental Health Month, so you should have been getting some information. There's a lot of activities that will be going on throughout the month. Please keep an eye on your inbox with information about those activities. I also wanted to point out our new tagline. Really like this new tagline, where hope and healing unite. And so you'll be seeing a lot more of that as well. And then finally, today is Nurses Day as part of Nurses Week. And so I really want to acknowledge all of our wonderful nurses, particularly during the pandemic. One of the areas of our department that we've kept open really from the beginning was our medical team and our ability to do lab tests and administer medications to the people we serve. And so our nursing team has been really integral to that. And then as we started vaccinations, we really have been relying on nurses throughout our department. Some of our nursing staff that work with the medical teams in both adult and children's, as well as nursing staff who work in managed care and other areas of the department, have really stepped up and helped the entire county, not just our clinic, but also other clinics in the county to get the work done. And that includes a couple of our division managers, Jolie and Karen, who stepped in and really gave their expertise and skill to the effort. And that's really what public health is all about. And our nurses have been an integral part of that. So today and every day, we want to applaud them and honor them. All right, on to COVID. So close to 150 million cases of COVID across the world now, with over 3.1 million deaths. Of note, the U.S. has really slowed down. We'll talk about that in a minute. Our increase from one week to the next was a little less than 1%. Comparatively, the increase in India was 14.7%. And at our peak in the U.S., we were at about 8.6% in the winter surge. And so we had some increases in Fresno that were like 12% or so, but India continues to struggle, and we'll talk about that in a minute. In the United States, and ignore the heading at the top, this is the May 6th results, about a little over 32.2 million cases and just under 575,000 deaths due to COVID. In California, we are still in the 3.6 million range of cases and approaching 61,000 deaths. We remain at about 1.3% positivity rate. It went down a little bit over the last 7 days, but then it started coming back up again. So 1.3 is that rate right now. And remember, again, we really need to get it under 1% consistently to feel like it's well under control. In Fresno County, 101,491 cases, 1,680 deaths. And our positivity rate has slightly increased a little bit as well. I'll talk about our tier in a minute, but we were even a little lower than what our tier says, and it's come up a little bit, so something that we're really focusing on right there. I will also say that we are performing fewer tests right now. We've talked about this previously, that if we don't perform enough tests, we won't be able to rely on the cases or the positivity rate as a true measure of the prevalence of COVID in our community. That's where we're really focused then on hospitalizations and deaths. So we'll probably be working hard over the next few weeks to get the number of tests increased. It naturally goes up when you have a surge of COVID in the community because people get symptoms, they develop COVID, they get symptoms, and they rush out to get tested. As the case rate goes down, fewer people go out and get tested. So then you're really relying on testing as more of a surveillance measure. Remember, I've gotten tested multiple times throughout the pandemic, not because I had symptoms and I've not been positive for COVID, but just to get tested and help with that surveillance testing. And so we'll probably be pushing more and more for people to get tested just as that measure of where we're at with COVID in the community. In terms of hospitalization, still just kind of staying in there in the 80 to 100 range. If you look on the right-hand side, we were 89, then 92, then 97. This week we're at 83, but just hovering around there, still with 20 or so in the ICU. Not as many ICU beds right now. Other uses of those beds, obviously, besides COVID. And so just again, something we're watching really closely. We're not seeing a significant decline in hospitalizations. It's staying pretty steady. And what that tells us is that COVID's still here. COVID hasn't went away. It's not rising, but it's also not lowering. So there are still cases of COVID happening actively in our community. And, I can't emphasize this enough. That means we're still going to have deaths. I personally know someone who died of COVID just in the last month or two. And so, this is something that's going to be with us for some time. All right, in terms of the tier system for reopening, you can see our positivity rate is showing here as 2.2. It's actually probably a little higher right now. Our cases per day per 100,000 is at 4.6. Both of those metrics were pretty close to getting to where we need to be to get below the orange tier. If we get below 2%, that's in the yellow tier. We do have to get the cases below 2 as well, and so we're a little further away on the cases. And then I just wanted to keep showing you California. We had Trinity and, believe it or not, Los Angeles move from the orange tier to the yellow tier, and then from the red to the orange was Inyo. So still continuing that trend of getting to better and better tiers, but at a little bit of a slower pace now. In terms of vaccinations, we now have 680,762 doses administered of the vaccine. That's completely awesome. Just under 270,000 residents of Fresno County have been fully vaccinated. Another 110, almost 111,000 have been partially vaccinated. And so this number now is creeping up. It's not going up just as quickly as it was before. And so about 36.6% of our entire population has been vaccinated, and about 47.6% of the eligible population. Remember, the eligible population are individuals 16 and over. But we are seeing a slowdown in vaccinations, which I'll talk about in a minute as well. In terms of 65 and older, again, creeping up here, we're now up to 80% of this population having at least one dose of the vaccine. And so we will continue with those efforts to get to the people who haven't had it yet. All right, so in terms of other things happening in Fresno County, we continue to see a downward trend in cases, hospitalizations, and deaths, but vaccinations are continuing to decline, and we're nowhere near herd immunity. COVID is not going away unless we get enough people vaccinated. If we stay roughly where we're at, it's going to be with us for years and years to come. And particularly if more variants emerge that the vaccines are less effective against. So the vaccine uptake, we'll say, that we're seeing in our community isn't quite what we need it to be if we're really going to eradicate or significantly diminish COVID. And so part of what we're going to have to really do is think as a community, how do we get people's questions answered? How do we really get to the root cause of why they might be reluctant to take the vaccine? What are the reasons that they have? And they all have reasons. This isn't to be taken lightly. We really need to listen and understand what those are, and if there's any additional information we can provide to help address some of those concerns. Because the more we can get people to take the vaccine, the better chance we have of really getting to a place where COVID isn't part of our day-to-day conversation. All right, how is India? The crisis continues. A lot of help is on the way, lots of feeling like it's not enough or it's too late. They've had over 226,000 deaths, and they're having as many as yesterday 410,000 cases in one day. And so they are really setting records daily. And it's really important to note that it's not just India, because it's now starting to spread beyond the borders of India. Places like Nepal and Sri Lanka and even Laos and the island of Fiji, there in the South Pacific, are all starting to see increases in COVID, and particularly in the variants that they're seeing in India. So again, it's that reminder that we are global now. We're very connected in ways, when we had the Spanish flu, that we were not. So things happening on the other side of the world will get to us, 100%. There's virtually no way for what's happening in India not to reach the shores of the United States. And so that's something to keep in mind as we deal with a virus, is that the virus doesn't care what country you're in. It doesn't care what your political beliefs are. It doesn't care what your religion is. It doesn't care whether or not you believe in the virus. It just keeps marching on. It's coming. And so that's the thing we have to contend with. The virus doesn't care about all of that. It's just trying to continue to recreate itself. And so that's something that we have to focus on. India has about 3% of their population vaccinated now, and about 9% have had one dose. Comparatively, I gave you those numbers for our community. We've had, quite a bit more are fully vaccinated. About 10 times that many of our entire population are fully vaccinated. So we're in a much better position. All right. And so again, what are the impacts of this outbreak? Well, obviously it's a humanitarian crisis. People are dying, people are not getting the care they need for COVID and lots of other healthcare conditions. But it also, again, allows the opportunity for more variants to emerge. And really that means any country where you have an outbreak, any country in any area of the world can contribute to those troublesome variants emerging. So the more we all work together collectively to reduce those outbreaks, the better. The other impact is that India is a major vaccine manufacturer for the world. I've talked about this before. There's a project called COVAX that's really working to get vaccines to underdeveloped parts of the world that can't afford to put the infrastructure in place that we have. India was contributing a fair amount of vaccine to that effort. That's been slowed down to a virtual stop now. And so that's of concern worldwide for vaccinations. And then India is the world's 6th largest economy and a major contributor to global growth. So when they're in the surge, they're shut down, and they really are challenged to continue to participate in that regard. And I would encourage all of you to find a podcast or a news article or something that you can read or listen to understand fully what's going on there and appreciate what our fellow human beings are dealing with right now. It is of note that many South American and Central American countries are experiencing a lot of civil unrest right now because of the extended impact of the pandemic. In underdeveloped parts of the world, as upsetting as it's been to us in the United States and how disruptive it's been to our routines and the things that we enjoy doing and our livelihoods and a lot of people's pocketbooks and the impact on their income and their ability to pay for rent and such, in third world countries, it destabilizes the entire infrastructure of a nation. And so there's been a lot of civil unrest and things that I know the world is watching very, very closely as hopefully we come out of this pandemic. All right, other vaccine news. The U.S. has agreed to waive intellectual property protections for vaccines. The reason that this is important is companies like Pfizer and Moderna and Johnson & Johnson have rights to the intellectual property of how their vaccine is made. And if those rights are protected, then other countries and other companies can't make that same vaccine. And their ability to make that same vaccine would enable more vaccine to be available across the world. And so if you can waive those rights, it just gives other countries an opportunity to produce more vaccine. They don't have to go through the testing processes. They don't have to go through the development of the vaccine. They can take it kind of like generic drugs. I remember when I was younger, Tylenol was Tylenol, and then later we started calling it acetaminophen, and once it became a generic, then you could get it a lot cheaper. It's kind of that way with vaccines too. There will need to be some worldwide support. I know the European Union is also looking at waiving those protections, but you'll also, it won't be an overnight thing. It's not a turnkey. It's not like you give them the formula and they just make it tomorrow. There would need to be a lot more infrastructure in place to manufacture it in other countries. Several new studies have been released about vaccine effectiveness. Both Pfizer and Moderna have produced studies. The Pfizer study is a little more evolved than the Moderna, just saying it's very effective against severe disease with at least 2 of the variants, the British and the South African variant. And then the early results show the Moderna booster shot was also very effective against the South African and Brazil variants. So they'll continue to do research on this as new variants develop. Those vaccine manufacturers are constantly looking at that information, assessing whether or not people who've been vaccinated with their vaccine are getting sick with these new variants, and if they get sick, do they get hospitalized or die? And then they're also developing booster shots so that if there's less effectiveness with the vaccine we've already been given, the booster shot might give us some additional protection. There is generally, I would say, a belief that we will, much like the flu shot, get some sort of shot more routinely to deal with COVID, but that remains to be seen exactly what that looks like. All right. So across the U.S., as I mentioned earlier, it does appear that most of the outbreaks are slowing down. I know there was an outbreak in Michigan that's beginning to taper off. Right now, we're at about 49,000 cases per day across the United States. About 40,000 people are hospitalized and about 700 deaths per day. However, experts are now saying they do not believe we will reach herd immunity across the United States. And this is my point about what's happening with the variants. The variants are one of the things that could undermine that herd immunity. Remember, herd immunity is when you're immune to the virus, and if the variants make it you less immune to the virus, that could interrupt the herd immunity. And then furthermore, the vaccine hesitancy. So the people who, for various and assorted reasons, are reluctant or have chosen not to take the vaccine, if that number is high enough, we just can't reach herd immunity. It's not possible. And so that kind of goes back to we really need to understand as well as we can where that concern comes from, and if we in fact could address it in any way, shape, or form. And again, vaccine is the only way to get it under control. What else is happening in Fresno County? Well, another Fresno County public health alert was issued today, and this one is a warning about opioid use disorder. There has been a significant increase in opioid deaths during the pandemic. So this particular health order addresses some aspects of regulation that allows for easier access to a treatment for opioid use disorder called buprenorphine. And I wanted to point it out here because it really underscores that during the pandemic, we've all been experiencing increased stress, increased anxiety, increased depression. Far more people are reporting mental distress during the pandemic, really than any other time in the recent past. And far more people are reporting use of substances to cope with that, whether that's prescription drugs or illicit drugs or alcohol, all are being utilized. We're seeing an increase in violence. People have road rage incidents, people have mask wearing incidents, and domestic violence is on the rise. Very early in the pandemic, we began to see this. This was part of our approach with the homeless population as we created additional capacity for victims of domestic violence to have a place to stay. Oftentimes when someone is a victim of domestic violence, they have nowhere to go. The person who's abusing them is in their home and they may not have another place to live. And that's where places like Marjorie Mason Center come into play, because they give those individuals and their families oftentimes a safe place to live. And so I really want to emphasize to all of you, I can say 100% there's been increased stress in my home. We've had more outbursts of anger, more just general frustration with one another, have to put my husband in timeout occasionally. He puts me in timeout. This is real. This is important. This is part of the work that we do. We have to do our own self-care. We've talked about this a lot, but I have to keep reminding you, we are not immune just because we work in the field. In fact, sometimes people who work in healthcare don't take as good of care of themselves as people who work outside. And so please, over the next week, really dedicate yourself to pausing in your household and really listening to what's going on. Setting down your phone, setting away all distractions, and really looking at what's happening and see if there's ways that you can care for yourself, help your household members care for themselves, and for goodness sake, if you're in an unsafe situation, get help. Don't stay in an unsafe situation. And this is something we're all going to have to do as we move forward. Just because things are returning back to normal doesn't mean that these stressors go away. In some cases, like with kids, they might increase when they go back to school and they find that school isn't what they thought it was, or people go back to an in-office work environment and some of the things that they gotten used to at home, they're frustrated by. And so we're all going to have a lot of grace for one another, and we're all going to have to slow down and really focus on taking care of ourselves and our families. I know I'm trying to do that with my family. We have lots of other things going on, as I know you all do, with high school graduations and college decisions and that type of thing. But it's really important that we all care for ourselves. You are important and you deserve to be cared for. And I really, really want you to care for yourself. So please dedicate yourself over the coming days and weeks to doing that. All right, I'm going to stop my presentation there. The rest of it's just stuff we've talked about before. I don't have anything particularly new to report in terms of return to in-office. We continue to diligently work on that. We're looking at all of our spaces, some new research is coming out that gives us some good, clear guidance on how to do that. And so we will slowly but surely put those plans together, and then we'll be communicating with you as that happens. All right. How is the department addressing the alarming rate in which DBH is losing clinicians in the last few months? I understand that hiring new staff is one way to manage that, but that seems like not enough. So a lot of companies, particularly in healthcare where it's been a very stressful year, are finding staff choosing to either exit the profession or find a different job or take some time off. Our own public health director, last week was his last week, and he's taking some time off before he chooses his next path. So, we've really worked hard throughout the pandemic to support all of you as best we can. There's lots of things that happen in people's lives that we don't have control over. So we recognize that despite our best efforts to support all of you, we might not be successful. We will continue to look at ways that we can do that. And we certainly are open to suggestions if there's something about the work environment that you think is contributing to people's departure. We're more than happy to hear that. It's not always easy to hear that type of feedback, but it's really the only way that we can improve things if that's going on. I will say, kind of carrying on my prior comments, people are stressed out. Their tolerance right now is pretty low. We've seen it with our staff as well. People are not always responding the same way that they would to a frustrating situation or a request or such. And so that's something we're just going to have to contend with even in our work environment as we move forward. But again, if you have ideas or thoughts, please feel free to share those with us. We're not perfect, and we'll always continue to strive to do our very best in that regard. Any discussion of letting some individuals work from home regardless of the state of COVID? I've reported on this pretty consistently, so I'll just repeat what I've said previously for those of you who might not have heard it. We do anticipate as we move forward that we will, in conjunction with some county efforts, look at remote work opportunities. That is going to take far longer to solidify than some of these other steps that we take. There's lots of processes that have to be gone through. And so as we develop our return to in-office work plan, you should anticipate that your position that might later be determined to be appropriate for remote work might not be given a remote work opportunity to begin with. And so that's something we'll be looking at. And certainly we've learned a lot through COVID. We've definitely learned what work is conducive to remote work and what work is not conducive. We've also seen that there's some work that's conducive to remote work, but there's some people who aren't cut out to be productive in that setting. And so we're going to have to kind of balance all of those things to figure out what's going to work best. I'm a big believer, as much as possible, in offering flexible work environments. And so I'm excited to look at this opportunity, but I can't guarantee you that all positions will be eligible. And so we'll just methodically go through that as we make those determinations. Let's see, I think we haven't had any additional questions. In a few weeks, we're going to have an all-staff meeting that's being scheduled towards the end of the month. At that meeting, we'll talk about things besides COVID. But I wanted to just prep you for next week. I'd really, really like to have more of an interactive next week. I want this to remain meaningful for all of you. And so I would highly encourage you between now and next week, if you have questions or concerns or feedback you'd like to give to myself or the department, please email myself or Tina Young with those questions, and I'll be prepared next week to spend a little more time simply addressing questions that people have. We don't always have a lot of people watching live, so I only can take questions from the live audience. So those of you who are watching this or listening to this as a recording, this would give you an opportunity to send those questions in, and I can answer them next week during the live update. So with that, let's see. Yeah, the anxiety is brutal. It is brutal. I think that this will sound odd given this conversation, but one silver lining of going through a global pandemic is it has really normalized the conversation about our mental health and well-being. And what I mean by that is collectively we've all been through it. We've had experienced social and physical isolation. We've experienced the anxiety of not knowing what was, think back a year ago when we didn't know what was going on, how long it would last, how bad it was going to get. And then experiencing either getting COVID or having a loved one or a friend, family member get COVID and die of COVID. We have had, people we all know who have not made it through this pandemic. And so we're now all talking about our mental health in ways that I think it was harder to do before. And so I'm grateful that at least through the pandemic, we're starting to normalize that conversation where people feel comfortable saying, I'm sad, I'm angry, I'm depressed, I'm frustrated. And so we've got to keep that conversation going. We have to take advantage of this opportunity and really use that opportunity to further our work. And in furthering our work, help people identify that they might need help and let them know that help is available and how to get it. And so that's really what we'll be dedicating ourselves to as we move forward, is making those connections and helping people make those connections that, wow, that is my feeling, and there's something that can be done about it. And so again, please take care of yourself. Please recognize in your own homes, in your own life situations, that we're all stressed out. Listen, support one another, and get help if you need help. With that, we will end today's, and please send those questions in for next week. I'd love to have a long list of questions to answer or provide you with information when I do my update next week. And happy Mother's Day to all the mothers out there, whether you're a mom to a child or a pet or a significant other or a friend. I hope you enjoy your day.